Hello, hello, hello. Welcome, welcome, welcome. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. We are back for another Wellness Wednesday. I was not with you all last week. I was under the weather, feeling a lot better now. So we're here tonight and we're going to continue our discussion on heat related illnesses. Um, During our last broadcast, our last live, we discussed heat exhaustion and heat stroke, what that looked like, what the symptoms are, which one is a medical emergency, which is heat stroke. We talked about some of the things that you can do to prevent that and how to prevent heat exhaustion from turning into a heat stroke, things of that nature. We had a question that was posed by one of our watchers, our listeners, someone who watched the broadcast, our last live. And so I wanted to delve into this topic a little bit more. So tonight we're going to be talking about dehydration and what that looks like, what that is. How do you know when you're dehydrated? So some good stuff. Again, thank you all so much for joining me. I'm so appreciative for each and every one of you that take your time to watch the lives, to catch the replays. Thank you so much. And at the end of the night, I do have a announcement that I'll be making. So some good news I've been waiting to share with you all. I will announce that towards the end of this broadcast. So what is dehydration? We know what it feels like, right? Dehydration happens when your body does not have as much water as it needs. We should be drinking a certain amount of water every day. And the standard is 8 to 10 8-ounce glasses of water per person each day. And I say the standard is because that is the standard of what research and science has showed that we need circulating throughout our bodies each day to maintain healthy body functioning. Depending on where you live, depending on if you have any medical issues, those numbers may change somewhat, right? So take what I'm telling you and just know that if you have any issues, any medical conditions, always, always, always talk with your healthcare provider, okay? My water is back there and I started getting thirsty, so I'm gonna take some water. That was good. If you don't have any water nearby, go grab some water. Drink your water with me, okay? So dehydration is when we don't have enough water circulating in our body. We don't have as much water as we need. And without it, your body does not function the way that it should, right? We should have enough water in our system to where our bodies are functioning the way that it should be. Some of the signs and symptoms of dehydration, we're going to talk about that tonight. But one question that was posed to me or that was sent to me afterwards, and someone actually messaged me, I think 2 people messaged me asking me, how do you know when you're dehydrated? So if I had to title this live tonight, it will be, how do you know when you're dehydrated? And when you're thirsty, chances are you're already dehydrated and it's too late, right? Some signs of dehydration is there's mild dehydration and then there's severe dehydration. There's several things that can cause dehydration. So some of the signs and symptoms of dehydration are dizziness, fatigue, you're really tired, dark urination, or not peeing enough. But the number one sign of dehydration, and the one that we think about the most, is when you're thirsty. Being thirsty is the top sign of dehydration. When you start feeling thirsty, you're already dehydrated. And so if you're drinking those 8 to 10 glasses a day and you're sweating and you've been outside and you're in a hot place like Florida, you can lose that water pretty rapidly, right? By sweating when you're working out. If you're sick and you have a fever, these are all things that could lead to dehydration. So it's important that you are keeping track of how much water you're drinking, that you're not so busy that you forget to drink. And I'm guilty of that. I'm so guilty that I get busy with my day and out of sight, out of mind. So that's why I have these big bottles of water. I also have a water bottle, and I meant to grab it, that lights up and it sends a message to my phone to tell me, hey, look, it's time to drink water. We have these nice smartphones that we can use, that we set alarms for different things. You have apps on your phone that you can set alarms that will help you remember when to drink. So let's talk about, we talked about what dehydration is. We talked about some of the early signs of dehydration. Headache is included in that as well. Typically, when you're running low on water or you have not had enough water to drink, sometimes you'll get a headache. I know me, I'll get this dull headache and I'm like, I got a headache. That's not typical. I don't have regular headaches. So if I have a headache, it's a bad headache. And so anytime I have these little dull headaches, I just know, okay, let me go get something to drink and then I'll make sure I drink water. I try to stay on track with my water, because if you didn't drink enough water yesterday, you're playing catch up for today. And so if you started your day already dehydrated because you didn't have enough water the day before, you're really playing catch up. So let's go to some other causes of water loss. We talked about fever, diarrhea, vomiting, if you're sweating a lot, being outside. Right now in Florida, the temperatures can feel like, I know in my area, the feel like temperatures have been 106, 108, right? And I heard on the news a couple days ago, they were talking about Las Vegas, and they were reading the temperature of the asphalt. And in some areas, the temperature of the asphalt was 160 degrees. And I know in those areas and some other hot, humid areas, it can get really hot. And so when I mention individuals based on where you live, you're going to lose water at faster rates than other individuals. So your body's going to tell you what you need when you need it. Peeing a lot. So if you're on medication where it causes you to pee a lot, diuretics, medication that helps you get rid of fluid from your body. If you have diabetes, and many times we have patients that come into us, or I've had a patient that has come to me, and their number one complaint is, I just keep peeing. I can't stop peeing. I pee a lot, and it's more than I used to. And we check them, and they are diabetic. If you're busy, again, and you're not drinking enough, you're playing catch up. If you're thirsty, you're already dehydrated. Our bodies are equipped with everything that we need to send us cues. Hey, something is wrong. And so if you're thirsty, as I mentioned before, you're already dehydrated. When you're sick, there's so many things that could go tie into putting you at risk for dehydration or causing dehydration. We talked about vomiting. There is right now the norovirus going around, and I'm just going to tie this into some of the things that are going around in terms of like different conditions and viruses. So right now there's the norovirus that's going around, and typically it's those individuals that are in close compact spaces, the cruise ships, some dorms at colleges, things of that nature, or those types of places. And so part of the norovirus is the nausea, the vomiting, and the diarrhea. And so you're not able to keep anything down, so you're losing fluid. And dehydration can kick in pretty quickly. Another thing that's going around right now is the rhinovirus, which is the upper respiratory virus, which is what I had last week. And with that, you're not eating because you have a decreased appetite. You have a fever, or you could have a fever. I know I did. And so you're losing sweat when you have this fever. You're not able to drink because you don't really have that appetite. For me, I had a sore throat, which is all a part of this rhinovirus that's going around. And so you have this sore throat, so you don't want to drink anything. I'm going to get rid of this. And so all of these things can come and cause dehydration. Another symptom that you may develop is cramping, muscle aches. Something else that you might notice if you're dehydrated. Your mouth becomes dry and sticky. You're not peeing as much, as I mentioned before. Your skin is cool and dry. The headache, and we mentioned the muscle cramps. Those are mild signs of dehydration. When we're going into severe dehydration, you're not peeing at all. And if you do, it's very little amounts and it's really concentrated yellow or orange. What happens is when you're taking water, it goes through your system, it's filtered, and it's filtered through your kidneys, and you pee it out, right? And typically, if we were to start an individual with drinking water at the beginning of the day, and we monitor every drop or every ounce that that individual drinks for a 24-hour period, what you drink, you should be peeing it out. When individuals have issues with their kidneys or other disease processes going on, maybe they have issues with their heart, congestive heart failure. We talked about that. If you've been watching our lives for any amount of time and you were here in February when we talked about heart health, individuals who have congestive heart failure, their heart is not pumping the way it should be. And so many times those individuals will retain fluid. So that's the swelling that you see in your feet, the puffy face, puffy hands, those types of symptoms. Those individuals, their bodies retain water, right? So if you're a normal, healthy individual, the amount of water that you're drinking, you should be also peeing out very close to the amount that you're drinking in. Your body takes the water in, it does what it needs to do, and then it gets rid of any excess. And that's where we have the urine that forms. But when you have an individual who has severe dehydration, they have little to no urine. And if it is some, it's really dark and concentrated. They may feel dizzy. They may have rapid heartbeat, rapid breathing. Their blood pressure may decrease because of the lack of fluid or the decrease in fluid within their bodies. And many times individuals' blood pressure will bottom out or decrease really, really dangerously low when they're dehydrated. And they may also pass out or faint. Sleepiness, lack of energy, some confusion may develop. So key here is drink your water. I'm thirsty, so I already know I'm probably dehydrated because I haven't drank as much water as I should. And then I'm coming off an illness. So I need to make sure that I'm drinking plenty of fluids to, in a sense, catch my body up for those days where I did not drink as much. Some symptoms that we need to pay attention to that are medical emergencies, and these individuals need to get into the hospital immediately, is if their blood pressure drops really low, they become dizzy or they pass out, their heart rate is really rapid and uncontrollable, they have not urinated or peed in more than 48 or 72 hours. Typically, you should be urinating every day, unless you have some issues with your kidneys. But if you're a normal, healthy individual who happens to become dehydrated and you do not have the production of urine, you need to go and get seen. Chances are, once they give you IV fluids, it's going to in a sense, we call it a fluid shock. It shocks the kidneys, is what we call it. We kind of give the kidneys what it needs in fluids in a quick amount of time. And then you begin to see that urine is being produced and that individual starts to pee again. So, who's at risk for developing dehydration? Babies and young children, older adults, individuals who are sick, those who have chronic diseases, those who are outside working. So the construction workers, pretty much landscapers, anyone who's outside for a prolonged period of time is at risk for developing dehydration. What can we do to prevent it? Drink your water. 8 to 10 glasses of water each and every day. Some days you may want more. I tend to drink a lot of water. And so on a normal day, when I'm 100%, I drink a lot of water. But I'm being honest, I have not been drinking as much as I should. Making sure you are spacing your time outside. So if you have to do any work outside, we talked about this a couple weeks ago, making sure you take breaks, go into an air conditioned area or a cool, dry place, a cool place that's away from the sun. Wear light clothing. Make sure you're drinking and that you hydrate yourself before you go outside and are in the elements, the hot weather. Some individuals who, let's just say you're going to go out and you know you're going to be outside for a long period of time, they will, in a sense, overhydrate and make sure that they are well hydrated before this activity begins. Another question that I got, how much water is too much? And what happens if you drink too much water, a lot of water in a short period of time? I can't really tell you how much water is too much for you because each individual is different. I can drink 1.5 gallons sometimes, but if I'm really active, if I'm working out, if I'm sweating a lot, then that's okay for me, right? But 1.5 gallons may be too much for someone else. How much water is too much to drink in one period of time? If you're going to drink water, you want to drink it slowly and not guzzle it down. Sometimes individuals can become really bloated and nauseous if they're drinking too much water, too much fluid too quickly. And sometimes individuals who have certain medical conditions, it can cause issues with their heart. It could cause some swelling on the brain. So you have to be really careful with that. Another question that I got is, I don't like water. What can I do? What can I replace water with if I don't like water? Nothing. Drink water, right? You can add some flavor to it if you want. You can squeeze some lemon or lime or juice if you want, not juice, but fruit if you want, infused water. There's different things that you can do, but you have to drink water. I like Gatorade, and many times I crave Gatorade because I know my body. And whenever I'm craving Gatorade, I know my sodium levels are low. So the Gatorade will replace the sodium levels, but it does not replace the intake of water. So drink your water. Don't be hard-headed like me. I'm telling on myself. And drink your water. Another question that I got is it bad to drink cold water? No, not necessarily. Sometimes you can get a brain freeze if you're drinking too much cold water too quickly. Sometimes you need that cold water to help you cool off. I tend to like room temperature water, but there are times when I'm hot and I need something cold or cool that is going to help cool me down. And so I will drink the cold water. Another question I got, or just in conversation, is cold water it'll hinder your metabolism. And that's not necessarily the case. That is not true. Again, you want to make sure that you're doing what is your preference. Some people prefer room temperature. Some people prefer cold ice water, and that's fine. There's really no research that I've seen that says drinking cold water is bad. I'm just trying to think of some of the other questions that I received. Alcoholic beverages tend to dehydrate you or cause you to dehydrate quicker. So if you are an individual and you're going out and you're having fun and you're drinking, I always say for every alcoholic beverage that you drink, make sure that you are also drinking a glass of water behind it. So those are some of the signs and symptoms of dehydration. And the number one is if you are thirsty, you are dehydrated. And we should be drinking at least 8 to 10 ounces of water each and every day. Listen to your body. It's going to tell you what you need, how much you need, and when you need it. It's when we don't listen to our bodies that we get into trouble. I'm not going to keep you out here long, but I do have an announcement. One that I've been waiting to share with you all. We have officially opened up our own brick and mortar space, office space. Our new location is ready and we're open there to see patients now, right? We are in Altamont Springs, Florida. The address is 452 Osceola Street, Suite 107, Altamont Springs, Florida. Wells Legacy Health and Wellness is now in our own physical location, and I'm so excited. We will be having a ribbon cutting, a grand opening, all of that. But in the meantime, if you need a primary care provider, if you have an acute illness, if you need a physical exam, so much more, I'm the person for you, right? I'm a board certified family nurse practitioner. I have over 27 years in the healthcare and nursing arena and field. And I'm here to help you however I can. But I wanted to share that news with you all. I've been waiting to share that news with you all. That we have our own space, that we will officially be seeing patients as of today in our new location. So more information to come on our grand opening, our ribbon cutting, and I'm just excited for this. It's something that's been a long time coming and something that has been such a desire of mine. And I wanted to share that with you all. So check us out. Visit the website, wellslegacyhealthandwellness.com. Come on over and see us. You can book appointments with us there. Our phone number is 407-306-6755. If you have any questions, we can get you a consult. We can take care of all of your healthcare needs. Until next time, stay safe, stay well, stay hydrated, drink your water. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. We will talk with you all later. Take care. Bye. Yes, ice on the wrist if you're overheated. Okay, so we're going to go back. My daddy always dropping little tidbits. Ice will help you cool down if you're overheating. So I think we talked about that. I'm not sure. But anyway, stay safe, be well, stay hydrated, and take care of yourselves. Talk to you later.